my name's Nyrah. I'm a GP pharmacist and I'll be your host for today's health show on British Muslim TV. Now, in today's topic of discussion, we will be talking about Men's Mental Health Awareness Month. As you may or may not already know, it's actually Movember, an annual event where men actually grow out their moustaches to raise awareness of men's mental health and other health concerns such as prostate cancer and testicular cancer. And to talk about this topic a bit more in detail, we have a great guest. His name is Dr. Munaf, and I have loads of interesting questions to ask him. And can we please introduce our lovely guest? Hi, Dr.
Hi, guys.
Munaf.
Hi, Nyrah. Thank you for having me.
Yeah, thank you so much for coming on. I think, the COVID and the pandemic has had the biggest impact on the mental health of both men and women. And I think a great initial question would be is first a bit about your role and explain to the viewers, what is mental health in simple terms?
Yeah, so good question. So I work on the COVID frontline across various hospitals in the Midlands, and mental health is essentially what we're seeing more of over the past 18 months since the last 3 lockdowns. Mental health is everything and anything to do with how the mind functions, how it thinks of itself, how it thinks of its surroundings, and the interactions a person has with his or her environment and social context. So it's a range of conditions from normal functioning, so to speak, all the way to low mood, all the way to kind of chronic depression, anxiety. You've got bipolar disorder there, you've got schizophrenia, psychosis. There's a multitude of conditions which fall under the umbrella of mental health. And really, I think, I really hope to just unpick some of the things which have come about due to COVID over the last 18 months, particularly anxiety and depression.
That's a great answer. There's so many different types of, mental illnesses in the UK. We have depression, anxiety, 2 of the biggest forms of mental illness in the UK. What signs could indicate that your mental health at home may be at risk?
Many things. So you've got 2 extremes of the spectrum. So the first thing is you become withdrawn, you become very sluggish, you sleep more, you eat perhaps a bit less, you like to keep the curtains drawn, you have less interaction with people outside. That's one extreme. The other extreme is you become very irritable, you become very, let's say, almost wanting to go out all the time, very haphazard in your behavior. Perhaps you're eating more, spending more. That's 2 extremes and everything that lies in between. So I think the main thing we're seeing now in November, especially as the days are getting shorter, is a lot of people getting a bit more withdrawn, missing the sunshine, getting what we call SAD, so seasonal affective disorder, lack of vitamin D causing dry skin, kind of a low mood, low energy levels, muscle aches and pains, and that's predominantly due to the lack of vitamin D. And so we must treat the medical conditions, but we must separate them from the actual mental health disorders which might have been there before the winter period came. And a lot of them will be depression, will be anxiety regarding the job marketplace, people's finances, what's it like going into winter? Will there be a 4th lockdown? All these kind of things which impact massively on people's perceptions of how they kind of exist in today's modern post-COVID society.
Yeah, that's a great explanation. I think so many people have heard the term Movember. It's more than just growing a moustache during the month. What are the aims of the campaign and what is it set out to achieve?
Yeah, Movember started a few years ago, really. Well, more than perhaps a decade and a half ago, because there was a lot of funding and a lot of awareness regarding breast cancer, ovarian cancer, cervical cancer in ladies, but much less awareness, particularly because men were less likely to get help and actually, let's say, feel their testicles if there were any lumps and bumps. So the last few years, I've seen a huge campaign with celebrities endorsing, such as Ronan Keating, on many adverts, of prostate cancer and testicular cancer, particularly, rising in the UK, because a lot of men were reluctant to seek help. So November was essentially a 1-month campaign where men shave their beards and grow their moustache to kind of indicate a solidarity with people going through cancer treatment and actually to raise awareness. And that's the main thing. If you see footballers and movie stars, etc., news presenters with a moustache, it does make you search why they've got a moustache now. And I think that's the whole public health rationale behind the Movember campaign, to increase awareness.
Lovely. And why do you think it's so important that men particularly speak up about their health? Especially if they're going through any signs of depression or they're feeling quite down. Why is it so important that we encourage men to speak up about their health?
The main reason is because men are traditionally seen as not seeking help. Men are traditionally seen as being more stoic and seeking help further down the line when perhaps help wouldn't necessarily be as effective because they've had months and months of being depressed or being anxious. So early help, we know as doctors, that's crucial to actually salvaging one's mental health. So early help, the GP could point people in the direction of psychotherapy in terms of low dose medications and all sorts of therapies which can actually be much more effective at the beginning, at the onset of symptoms, as opposed to leaving it late where perhaps men have suffered for many, many months, and any therapy to bring them back to a normal mental health baseline can be quite futile. So it's crucial that men seek help early, because that's where most of the evidence we have for medication actually works.
Yeah, and talking about mental illness, as an umbrella term, and if we were to horn into depression, depression is one of the leading causes of premature death now in the UK. I was reading some reports, and they suggest, even 6 out of 10 suicides are actually carried out by men. What happens to our bodies when we go through depression?
Yeah, so that's a harrowing statistic. So 60% of suicides, and the leading killer of men under 40 is suicide. It's not heart attacks or road traffic accidents, it's actually suicide. And the biggest cause of suicide is depression. So, sorry, what was your question?
What happens to our body when we go through depression?
So many things happen. So you can see depression as a chemical imbalance. So one of the happiness chemicals. So we've got many. We've got oxytocin. We've got melatonin, which is a sleep hormone. But the main hormone which is deficient or which is lacking in the frontal kind of cortex of people going through depression is serotonin. So serotonin is a happiness chemical. It's that chemical of pleasure, of bonding, of just generally good mood. And the frontal lobe of the brain, that's what does executive function. So memory, it does all the planning, prior planning, it does all the kind of social kind of constructs that a person lives in. And there's evidence out there that people who go through depression, their serotonin levels are lower. And that's why one of the main treatments is what we call SSRIs, so selective serotonin reuptake inhibitors, whereby chemically we try to alter that balance in favor of serotonin. So serotonin does increase, and the people kind of just have an equivalence of serotonin, therefore slowly get back to normal levels of happiness.
Yeah, that was a really nice, easy explanation. I'm sure, viewers at home will be able to understand the explanation as well. And you mentioned, SSRI. So there's so many different pharmaceutical medicines now you can be prescribed for depression or anxiety. What are your thoughts on therapies or non-drug therapies for depression or anxiety?
I'm a big believer in non-drug therapy. So I'm always been a believer in animal therapy, art therapy, social therapy, in psychotherapy if needed. There's many types of psychotherapy. Actually, the father of psychotherapy passed away 2 days ago. Dr. Beck, actually, he was 100 years old. He was the father of modern day psychotherapy, cognitive behavioral therapy, which aims to reframe people's thinking about their life and their circumstances. So, and that is it's a hands-off approach in terms of medication. You actually sit down with the patient, go through their expectations, go through their childhood, go through their traumatic events, and go through what brought them into a state of depression now. And I think for me, that's much more long-lasting and much more effective than just simply pushing out pills like Smarties, which a lot of people do, unfortunately, because we live in such a fast-paced world. People want a quick fix, but often the fix is not quick. And once, as clinicians, like yourself and like me, if we take time with our patients and understand why they are going through what they're going through, we can perhaps unpick and break down some of the 3Ps, so the predisposing, predisposing, precipitating, and perpetuating factors behind the episode of depression.
Lovely. And can depression, can that occur at any age, or does it occur at a particular lifetime? I was actually reading reports last week, and it said that the highest rates of suicide are actually in men ages between 41 to 49. Now, is there such thing as like a midlife crisis that men can actually go through later on in life?
Yeah, a great question. So actually, if you look at it medically as well, men's testosterone does kind of plateau beyond 35, and then it slowly decreases after 40. And we know testosterone is a happy hormone itself. One of the things we say as doctors, testosterone makes you happy and hungry. And when that slowly declines, that's why you get a spike in rates of depression and suicide from 41 to 49, the so-called midlife crisis. So that's one of the reasons, perhaps. But also, another reason is men's the expectation of men gets quite high at 40 to 50. It is the age where they should be considered to be set in their careers, and if people aren't set in their careers, or they've not got a house with 2 cars, etc., by that time, expectations now with social media, there's a lot of comparisons which can sometimes adversely affect men's mental health. And body image is a big thing for men now, especially with Love Island. Lots of young men with their six packs. So I think a lot of men are getting the body image issues in their 40s now as well. So I think it's more than a midlife crisis. It's a physiological reason, it's a social reason as well, and it's essentially a lot of it's where you expect yourself to be. And as they say, comparison is the killer of joy. So when you compare yourself to other men in that same age group, and you see yourself as not doing as well as them, perhaps you might then become inwardly and withdrawn and then start projecting some symptoms of depression and low mood in that sense.
Yeah. All right. Thank you so much, Dr. Munaf. I think we will be coming up towards a break very shortly. Just to recap part one, it's been really informative so far. We've interviewed a lovely, lovely guest, Dr. Munaf, who's given us such a good introduction into Men's Mental Health Awareness Month. Now, for further information about men's health or Movember, you can visit the NHS website or movember.co.uk. Please join us after the break again. We'll be interviewing Dr. Munaf for further questions. Get to tune in. Welcome back after the break. My name's Nyrah. I'm a GP pharmacist and I'll be your host for today's health show. Now, in part one, we actually interviewed a very special guest known as Dr. Munaf, and we were discussing Men's Mental Health Awareness Month. It'd be great if we can just pick up on where we left from and continue asking Dr. Munaf about questions about men's mental health, especially depression and anxiety, which has actually risen due to the pandemic. Dr. Munaf, you available for further questioning? Great. I think let's kick it off with, what is anxiety? We hear about depression's on the rise, but anxiety is another big common illness that's actually affecting the younger generation. What is anxiety, and what advice would you give to maybe younger males who are suffering with anxiety? Where can they go for help even?
Yeah. So anxiety is a form of worry about the future. So we see it as depression being about the present and the past, and anxiety being very much about the future. People worrying about what's going to happen, people being on edge. A little bit of worry is fine. That keeps you, a little bit of nerves keeps you, performing highly. Because if you become blasé and complacent, then you don't perform well. But having excessive amounts of worrying, which then impacts on your cognition, how you think about things and how you perceive things, that's what we call anxiety. The most common form of anxiety is what we call GAD, generalized anxiety disorder. And that's when people are anxious about many things. They perhaps overinflate the importance of certain things. And then this can go into then phobias. People live in the house, agoraphobia, so many kind of, claustrophobia. These are all phobias. So that's almost a form of anxiety, which is opposite to depression. Depression is more about becoming inward and, lack of emotion almost. You become almost numb. You have lack of energy. Anxiety is almost the opposite. You have a lot of energy. You have a lot of nervous energy, and you worry unnecessarily about the future. And absolutely, you're right, Nyrah. During the pandemic, anxiety levels have almost gone fivefold now. And I think 1 in 20 people, 20% of people, 1 in 5 adults have experienced some form of anxiety over the last 18 months, whether that's anxiety about getting COVID, about their parents getting COVID, about their children, about school reopening, and about their own workplace. Jobs have not been secure. And, just the anxiety about what's going to happen in December. Most people are anxious about that. Are we going to go into another lockdown? What's going to happen to the gyms and schools and pubs and clubs? So 1 in 5 people have experienced some sort of anxiety. And I think it's pretty obvious why. There's a lot of uncertainty about COVID and vaccines and government announcements. And so, yeah, it's been the biggest trend, really, much more than depression has been anxiety.
Yeah, and where can younger individuals go for help if they do experience any symptoms of anxiety? I know it might be a bit difficult to get a doctor's appointment or to see a psychologist, get some therapy, but where else can people get some good, trustworthy, evidence-based information online? There's so many things. Dr. Google's out there. Is there any particular websites or any online charities you would actually recommend?
So first and foremost, being an NHS doctor, I would always recommend NHS website. So NHS website is great. It's got a list of conditions there. The second one is CALM, so Campaign Against Living Miserably, a very good campaign targeted at men, particularly young men, who often fail to seek help for anxiety, depression, etc. And the third one is Mind. Mind's a mental health charity, which deals with, it's got a lot of good resources about depression and anxiety. So them three, NHS, CALM, and Mind, all three can be found online, and great resources which I use myself on my own patients.
Right. And what kind of advice would you give to anyone that's actually going through anxiety, or depression?
So first and foremost, I would say speak to family and friends, see if they've noticed changes in you as well, because a lot of things, so sometimes it can just be you, and other people haven't noticed that. So I think asking them how they've seen you over the last few weeks. Are you more forgetful? Are you more anxious? Are you more kind of withdrawn, etc.? So always seek some kind of perhaps some kind of confirmation, but don't hesitate to phone your GP if you are experiencing debilitating anxiety or depression. I think seeking medical help is one of the most important things you can do, because we know delaying seeking help can have catastrophic consequences down the line, and then your GP itself can refer you for forms of therapy, psychotherapy, CBT being a form of that. He or she can also signpost you for local services, so counselling if needed, etc. So there's a waiting list, obviously, in the NHS, but now there's been a big proliferation of apps. Now you can use apps for there's a Headspace, there's Calm. These are great apps which are more for mindfulness and meditation, but certainly I have recommended them to my patients for anxiety and depression, because they essentially focus all your energy onto the present. And as we mentioned before, anxiety is positive energy about the future, and depression is energy about the past. Whereas these apps like Calm and Headspace really bring everything back to now, and they encourage you to concentrate on your breathing. And it's reasonably cheap. It's £50 for the whole year, and you can get free memberships as well. So that's one of the things I would recommend if you are finding it difficult to get an appointment with the GP.
Yeah, I completely agree. There's so many good resources now, like the apps, like the Headspace. And I think most importantly, another good resource is the Mind charity. And they actually counsel you on breathing techniques. There's been so many studies that show just focusing on your breathing and slowing down your heart rate actually helps with your anxiety physical symptoms. And just talk about anxiety and influencing factors in general. There's so many different factors that are affecting the onset of depression, anxiety. What do you think are the biggest factors that are influencing the onset of anxiety in today's generation? Is it a combination of factors?
Yeah, it is a combination of factors, but I think the elephant in the room is smartphones and social media. I think comparison, people comparing their lives to other people's, always trying to keep up with the Joneses, that has brought about an unprecedented level of anxiety amongst today's, particularly teenagers. Body image as well is a big thing. And, body dysmorphia, eating disorders, very common, not just in females, but also in men as well. So anxiety about your body shape, about your appearance, about your partner, about your job, even about your car, your house. These things are now more apparent because of people sharing on social media. Nyrah, you're very big on TikTok, and TikTok's a great resource, and as is Instagram, and the great resources. It's a double-edged sword. You can use it for your benefit, or we know people who've committed suicide, from Instagram not getting enough likes, etc. There have been cases where young ladies have taken their life because they've not got a response to a certain photograph, and I think that is the elephant in the room, which our young minds, particularly in the teenagers, aren't necessarily adapted to having these big hits of dopamine, which happen with social media. So you go from a high to a low, and when you get that crash of dopamine, which is a pleasure hormone, so a lot of people can't take that, and they end up either being anxious or going into depression.
Exactly. Social media has one of the biggest, strongest impacts on mental health, especially, of course, the young teenagers. And I think, in general, do you think there's a stigmatism about mental health, in men? So many men might actually, shy away from actually speaking up about their emotions or their mood. We have different cultural beliefs and social norms. What do you think about stigmatism and mental health?
Yeah, it's a huge problem, especially in the Muslim community and the Muslim male community. We're told to just lace up our boots and just get on with life, and not worry about it, and roll up our sleeves. And mental health is for girls, really, or it's for women. Men shouldn't cry. This all kind of cultural stereotypes which are very damaging. Men, we're humans. We have emotions, the range of emotions, and trying to curtail a certain emotion, such as softness, empathy, and crying, it's very damaging, actually. And we should have the whole range of emotions. If you don't express emotions, you don't live the full depth of life. So I think. So, I encourage all men to speak out. There's a very good app, actually, Canadian-based app, and I've been using it myself personally, as well as for my friends. It's called Tether. And it's just a forum for men on their phones, just to chat about anything, really. It's male only, it's in men only, because, we know the problem lies with men not speaking about mental health. So it's time for us to really, to quash that stigma. There shouldn't be no stigma, because the first part to address any problem is to recognize it.
Yeah, definitely. And just to kind of conclude from mental health, just summarize what Dr. Munaf said, there's so many resources out there. If you do speak up, you will receive that help. And I know Movember, it's not always just about the mental health. They will also raise the awareness of testicular cancer and prostate cancer. Statistics show that 1 in 8 men in the UK are at risk of actually developing some sort of sign of prostate cancer. What is prostate cancer?
So prostate cancer is enlargement of the prostate, which is beyond what we call benign. So it's malignant, as in it's more than just normal growth. Things grow with age, but prostate cancer is when the growth is beyond what we'd expect with age, and it can spread. It can spread to the bones, like any cancer. It can spread to kidneys, brain, etc. It needs treatment, and the treatment usually is chemotherapy to shrink it, radiotherapy, and removal of the prostate. Nowadays, we can do that by a robot, so the surgery is not that big a operation like it used to be 10 years ago. So I would encourage all men to get the prostate checked out, especially if they're having symptoms of urinary frequency, dribbling, difficulty getting a stream. These what we call LUTS, so lower urinary tract symptoms. So NHS website again has all these resources on there, but it's imperative that men get their prostate checked out above 55 for Asian and Black men, above 65 for Caucasian men. It's vitally important, because you don't want to end up in a situation where your prostate's it's become cancerous and it's too late to operate.
And what age group did you say it covers? It can affect anyone or particular age group?
Yeah.
I think you did mention it.
Yeah, so I said in Asian and particularly Caribbean men, we tend to screen a bit earlier because there's a higher risk of prostate cancer. So I would say 55, and in Caucasian men, 65 or 60, so a bit later on. But any man, regardless of age, any man above the age of 40, if they're getting symptoms of a urinary dribbling, poor stream, if they're getting incontinence, stinging urine all the time, and this is separate from a urinary infection.
Dr. Mark, I think that's all we have time for today's show. You've been so helpful today, really informative. discussion we've had about so many different topics. We've talked about depression, we've talked about anxiety, we've even touched on prostate cancer. Now, you can follow Dr. Munaf on his Instagram, you can shout to him, and don't forget to follow us on Facebook,